My name is Sadie Minkoff. I'm the Vice President of the American Board of Oriental Reproductive Medicine. You can always come and talk to us. And I have the privilege today of introducing Karen Gillerman, who is a world-renowned acupuncturist and researcher. She studied in the 90s in New York City, in San Diego, as well as in Israel. And now her research is also spanning many countries, Israel, the UK, and Italy soon. So we are very excited to have her here and talking to us about her research and her randomized controlled trial on acupuncture and its combination with in vitro fertilization.
Thank you. Can you hear me? Okay. I must start and say that this is well known around speakers' jargon to be the graveyard shift. You've all had your lunch, you're tired, the last thing you need now is another talk. So I will try to keep you awake. I was lecturing last month actually in Norway, and while I was talking, I noticed one guy at the first row who fell asleep. As long as he was quiet, it was okay, but then he started snoring. So I quietly said to the gentleman who was sitting next to him, "Excuse me, could you please wake him up?" And his first response was, "Mrs. Gillerman, you put him to sleep, you wake him up." So I will hope this will keep you awake. Okay. I'm going to present to you the study we did at the Homerton University Hospital in London in the UK, the effect of acupuncture on IVF success rates, which we did in our fertility center. It's one of the largest fertility centers in London. It caters 1,500 IVF cycles per year. Before I'm going to start, I just want to say that the idea for the study came from a need, an actual need. I was practicing since 1998, and for the past 17 years, my mainly practice in the UK is fertility cases. So as I've been in the field for quite a long time, I'm lucky to have referrals from doctors, from GPs, from gynecologists, but most of the physicians won't refer their IVF patients to have acupuncture. No, it's not because of their ignorance. It's because they don't have evidence-based conclusion whether acupuncture is beneficial for IVF treatments and should be offered to their patients going under IVF. If you look at the literature, there's such a great heterogeneity. There has been so many clinical trials to try to assess the benefits of acupuncture for women undergoing IVF, but they all differ significantly in their study design. Many protocols, different acupuncture sessions, different acupuncture timings, different acupuncture protocols, different outcome measures. This great heterogeneity precluded us to reach a conclusion whether acupuncture is beneficial for IVF treatments and should be offered to women undergoing IVF. To address this heterogeneity, in 2012, Professor Caroline Smith from Australia, I believe, she gathered 15 international acupuncturists with extensive experience in treating women undergoing IVF, and the aim was to reach a consensus protocol for which acupuncture is the best to use for women undergoing IVF. They went through 4 rounds of Delphi questionnaire, and they tailored a protocol, a consensus protocol to be used for women undergoing IVF and for future research. We adopted this protocol and we used it in our study. Before I'm going to go through the presentation and explain to you exactly what we did, and we did have very promising, very significant results, because from my experience, each one of you is going to ask, so give us the points, give us the points. I'm going to go through the Delphi protocol. We're going to do it very briefly, and after my presentation, I will write you down all the points and explain to you exactly why I think we've used them, okay? Now, what we did here, we tried to gather all the information we could and analyze it to show that there were no significant differences between the two groups, which is very important. So, So we had 2 groups, group 2 and 1, the acupuncture group, the intervention group, and the control group. We've looked at their age to see there were no differences, major differences in the age. We looked, of course, at the beta HCG to see if they got pregnant or not. We've looked at how many attempts they had. We looked at the BMI. We looked at some hormones, the AFC and the AMH, which is just here. We looked at the kind of diagnosis. Was it anovulation, tubal, unexplained infertility, male, endometriosis? We've looked at the protocol to see if it was long protocol or short protocol, agonist or antagonist. We've looked at the egg collection, how many eggs we were able to retrieve. we've looked at the embryo grade. I was extremely amazed and surprised to learn that we didn't have any differences between the two groups regarding the embryo quality. I was sure that the patients from the acupuncture group will have better quality of embryos. And then, of course, we looked at the final outcome. Was it a live birth, miscarriage, or negative result? Okay, 157 women were allocated randomly to the intervention group and the control groups. The intervention group, 79 patients, were programmed for a full acupuncture treatment according to the Delphi protocol, whereas the control group, 78 patients, did not get any acupuncture at all. On the 79 women allocated to the intervention group, 15 withdrew from the study, did not do the acupuncture treatment at all, did not finish the full treatment, or had a cancelled cycle, compared to only 9 women from the control group. The number of dropouts in the acupuncture and control groups was significantly different. Now, can you think about the reason for that? Do you have any idea? I'll tell you what I think, what we think. As I said, when you come to a woman, you say to her, we can increase your chances to get pregnant. We might be able to increase your chances to get pregnant by giving you acupuncture. She'll say, yes, 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 I want to be part of it. And then she'll be very happy when she learned she was randomized into the acupuncture group. But then she's starting the IVF cycle. IVF cycle is very, very difficult to deal with. That lady had to come every day, almost every day, to the clinic for her blood tests, for her scans, for the trigger shot, for all the injections. So sometimes they said, you know what, I'm not coming to acupuncture. I don't want to add more stress and more appointments to what I already have. Sometimes we had women who, just from ignorance, although we explained to them exactly what acupuncture is, they thought it was like injections and needles. They just didn't want to do it because they were still having their injections at the clinic. And some patients were so stressed on the day of the embryo transfer. So although they came for the first acupuncture session between day 6 and 8 to the stimulation stage, they just totally forgot to come on the day of embryo transfer. Okay? So after excluding the dropouts from each group, a set of chi-square tests was independent was performed in order to examine any differences between acupuncture and control groups regarding basal parameters and rates live birth, miscarriages, and positive pregnancy test. Now listen to that. Rates of live birth and positive pregnancy test were found to be significantly higher in the acupuncture group compared to the control group. We couldn't find any statistically significant differences between the groups regarding to miscarriage rate. So look at that, please. This is quite amazing. Again, this is just following the Delphi consensus protocol, who was agreed by the 15 international acupuncturists. The embryo grade, again, it was the same. No significant differences between the two groups. Pregnancy positive was 53% in the acupuncture group, pregnancy rates, opposed to only 27.5% in the controls. This is quite amazing. Miscarriages, not much difference. Live birth, we had 42% live birth rates in the acupuncture intervention group, opposed to only 15.9% in the controls. This is, I don't know if you know anything about research, about studies, this is quite a significant result. And this is following the Delphi consensus protocol. Now, if you look at that, I look at it and it's quite amazing. When we talk about live birth, we don't really care about, well, we care, but we less care about pregnancy, clinical pregnancies. We care about live birth for the woman, for the patient to take a live baby, a live crying baby home. And when I look at that, again, it's quite surprising for me to know that there were no differences between the two groups when it came to the quality of the embryos. So to me, it says that the success of the IVF, it's not just about the quality of the embryo, it's about the woman. It's about the condition of the woman to absorb pregnancy, okay, to absorb life. The women in the acupuncture group had better chances to get pregnant because they were more ready, their body was more ready. We worked on stimulating the blood circulation to the ovaries, to achieve good follicles in quantity and size. We worked on stimulating the blood flow to the uterus to achieve good uterine lining. We worked on balancing the hormonal system, the nerve system. They had better conditions in their body to absorb a pregnancy. And this is quite amazing for me. The strengths and limitations of this study. This study was the first to follow a widely approved consensus protocol and therefore has set a standard for future studies. And again, I was very happy to hear that last year in Texas, Zhang adopted that protocol, the Delphi protocol. This was a randomized controlled trial with a powered sample size. The limitation. So my colleagues at the Homerton Hospital thought that the additional attention paid to acupuncture group as opposed to the controls may have had a positive psychological influence. I think it's rubbish, excuse me. Because when you, no, honestly, when you measure something subjective, such as pain or general well-being, yes, you can say that extra attention to one group might have a positive psychological effect. But when you measure something so objective as live birth, such influence is not relevant. By the way, you'll have to excuse me, I have a very deep Israeli accent, although I've been to the UK for so many years, so excuse my accent, although I must say that since Gal Gadot became Wonder Woman, I feel more in peace with my accent, with my Israeli accent. Okay, as I told you, the patients from the acupuncture group received quality of life questionnaire. That was an international quality of life questionnaire. They filled it twice, before they had acupuncture, when they signed the consent form, and after they had 3 rounds of acupuncture sessions on the day of the embryo transfer. So the quality of life before was 35.2 and after was 36.4. And for the question, do you believe acupuncture can contribute and add value to the success of IVF? Before it was 7.68 and after it was 8.58. When we talked with them about quality of life, the quality of life questionnaire, it was questions about mental stability, depression, if they had any, constipation or diarrhea, libido, hot flashes, night sweats, abdominal pains, stuff like that. Our conclusions. The results of this study imply that acupuncture should be offered as a possible method of improving IVF outcome. We now intend to investigate the pathway in which acupuncture increases pregnancy rates with specific attention to measurements of nerve growth factor and hormones of autonomic nerve system.